Hello, everyone. My name is Danielle Jones, and I'm a third-year PhD student in the Rehabilitation Science program in the Department of Physical Therapy. And today we're going to be talking about antihypertensive drugs and exercise, considerations for hypertension. So what is hypertension? Hypertension, or high blood pressure, is defined as consistently having a systolic blood pressure greater than 130 millimeters of mercury, or a diastolic blood pressure greater than 80 millimeters of mercury. This leads to an increased force being exerted by blood on the walls of the arteries and major blood vessels in the body. And this can lead to damage in the arteries, the vessels, and the heart, where tears can form in the walls of the vessels and plaque can form, which leads to atherosclerosis, increased risk for heart attack, and ischemic and stroke. All of these increase the risk for cardiovascular disease, which hypertension is the #1 cause of cardiovascular disease. And this lovely chart here depicts the different levels of blood pressure and where hypertension starts, which is at 130. Where it used to be 140, we now know that there are greater impacts on health outcomes, even when your blood pressure is in that 130 to 140 range. So we now know that hypertension needs more intervention even at these lower numbers. So this graph is depicting the prevalence of hypertension in the United States. And as you can see, the South lives up to its name of being the stroke belt, and that the South has this greater prevalence, age-adjusted prevalence, than other parts of the nation. And we see that Alabama, Mississippi, and this little area right here have the greatest prevalence of hypertension. And this is hypertension that is mostly untreated. So the global prevalence of hypertension, it is thought that there are over 1 billion people in the world who have hypertension, and most of these individuals are living in low and middle income countries, as you can see in the figure here. It is thought that 1 in 4 men and 1 in 5 women have hypertension. However, fewer than 1 in 5 people with hypertension have the problem under control and are not taking medications. This leads to hypertension. Hypertension is one of the leading causes of premature death worldwide, and it's also the leading modifiable cause of premature death and cardiovascular disease. So the risk factors for hypertension include modifiable and non-modifiable risk factors. Some modifiable risk factors, of course, include sedentary lifestyle, physical activity, your diet, such as your high sodium intake, obesity, smoking, alcohol consumption. These non-modifiable risk factors include race, gender, age greater than 65, family history of hypertension, or comorbid chronic conditions such as kidney disease and diabetes. These non-modifiable things cannot be changed. And people of, for instance, race, people who are African American have a greater incidence and risk of hypertension, as well as CVD risk. So there are different treatments for hypertension. First line of treatment typically, especially in younger individuals, is exercise, dietary changes, smoking cessation, stopping the drinking. But there are also efficacious treatments that involve medication, and medical treatment usually is done with antihypertensive medications, and these work to reduce blood pressure and also minimize the risk of developing cardiovascular disease. And it's thought that the combination of both medication and lifestyle modifications should be prescribed to people with hypertension, but this can depend on chronic conditions present and the severity of the hypertension. There are multiple classes of antihypertensive medications that can be used to reduce blood pressure and treat this disease, and these can work through several mechanisms. In the United States, the most commonly prescribed medications for hypertension are angiotensin converting enzymes, ACE inhibitors, followed by diuretics, angiotensin receptor blockers, ARBs, calcium channel blockers, and beta blockers. And these, more often than not, are often prescribed with lifestyle modification to optimally lower blood pressure and improve cardiovascular health. So what are the type of classes of antihypertensive medications? Well, these can include diuretics, ACE inhibitors, ARBs, calcium channel blockers, and beta blockers. And these are the most commonly prescribed. And diuretics work through the kidneys, and they help expel excessive volumes of water and sodium that are in the blood through the urine, which helps lower blood volume and blood pressure. ACE inhibitors work to stop the production of angiotensin, which helps which keeps the blood vessels from becoming narrowed, and this helps them to relax and dilate to lower blood pressure. ARBs also work to prevent action of angiotensin and dilate blood vessels. Calcium channel blockers open up narrow blood vessels by preventing calcium from entering into the smooth muscle, and beta blockers reduce heart rate and the workload in the heart to lower blood pressure. So exercise and hypertension. Exercise is another common treatment for hypertension, and there is evidence that it might be just as efficacious as medication in lowering blood pressure. However, there are less studies done, especially rigorous intervention studies out there for blood pressure and for the effects of exercise on blood pressure. The effects of antihypertensive are extensively more studied. So exercise does have well-known benefits for lowering blood pressure in adults, and it is both a method of primary and secondary prevention of hypertension and CV and cardiovascular disease, in that regular exercise can prevent the onset of these diseases, whereas after these occur, they can also be used to treat and lower blood pressure. Aerobic activity is usually recommended for exercise, but strength training and stretching are also indicated to be highly important for improving blood pressure. And as you can see in this figure here, it is the combination or resistance exercise appears to have the greatest reductions in this particular population on blood pressure. But it is unknown if these individuals in this figure are taking antihypertensive medication. So I thought this chart was a really interesting chart in that it demonstrates the effects of different types of exercise on different health outcome measures in people who have obesity. And it's funny that these different exercises really don't affect weight loss, but all the exercises, resistance, dynamic and isometric, aerobic and HIIT, all appear to have significant evidence that these can significantly impact blood pressure and lower blood pressure in people who may have hypertension or who aren't diagnosed with hypertension. In those who are diagnosed with hypertension, there is still good evidence that this can help people with hypertension lower their blood pressure. However, it may be that the combination of both antihypertensive medication and exercise is needed to optimally lower blood pressure in those who have hypertension. This is a great chart from the new ACSM fit recommendations, and it talks about just the frequency, intensity, time, and type of exercise that can be used to reduce blood pressure, and just some general guidelines for prescribing exercise I thought was great to include in here. So exercise and hypertensive medications may have a synergistic effect on severe hypertension that requires medication. In fact, one study indicated that ACE inhibitors had no effect on physical performance during vigorous physical activity. And this medication might be an option for for adults who have hypertension, but are also physically active. Another study examined the effects of beta blockers on exercise performance in people with hypertension, and VO2 max was measured before and after treatment with the medication. And study results indicated there was no significant decrease in heart rate and blood pressure, or there was a significant decrease in heart rate and blood pressure at rest and during maximal exercise testing. However, there was no significant change in VO2 max between baseline and follow-up, and work performance was not significantly impacted, which indicates that while these medications do affect heart rate and blood pressure, they may not have as great of an effect on the capacity to do the work. So these people can still get the benefits of exercise without it having major contraindications for their blood pressure and performance. So certain blood pressure medications can interfere with exercise because these medications do impact blood pressure and heart rate. For instance, beta blockers cause a slower heart rate. Diuretics and ACE inhibitors can lead to hypotension, which is an excessive reduction in blood pressure after a workout. This can lead to dizziness and fainting. And it's advised for people who are taking these medications to always perform a cool down to overcome excessive reductions in blood pressure after exercise. Antihypertensives should not impair other aspects of physical performance during exercise, such as VO2 and perception of exertion. But it's important to determine the type, duration, and intensity of exercise, and we must be mindful of this medication regimen, particularly when one first starts the medication, which is why this is a great recommendation for individuals and their physicians who are starting a new exercise routine to lower their blood pressure. So antihypertensives do cause an altered cardiovascular response to exercise. And so this means that methods for attaining heart rate, target heart rate, and estimating VO2 max from submaximal tests from your heart rate may not be valid for individuals on these medications. So the targeted intensity of exercise should be determined with different measures outside of the heart rate reserve method. For example, we can examine VO2 max with an indirect calorimetry or the rating of perceived exertion. And these can help determine fitness and exercise intensity for people with hypertension who are taking hypertension medication. A cool down after exercise is an absolute must to enhance venous return and prevent pooling of blood in the muscles. And this can also work to prevent hypotension, that excessive reduction in blood pressure after exercising. So to conclude on this short presentation, the most efficacious and effective management of hypertension seems to be both treatment with medication and exercise and dietary changes. Antihypertensive medications should not interfere or negatively impact the benefits of exercise for hypertension. These medications most likely will not compromise a patient's ability to complete exercise to their max, even though they do reduce heart rate and blood pressure. They may be helpful in reducing the dangers associated with exercise-induced blood pressure increases without reducing the work capacity in the individual. And evidence suggests that certain medications do not lead to impairments in performance and physical fitness measures of these and physical fitness measures. And these medications are particularly advantageous for people who have hypertension but want to remain physically active. Here's my references, and I hope everybody has a great day.